Stomach cancer is often a silent killer, growing quietly in the shadows, until it reaches a dangerous and advanced stage. But what if your body has been sending you subtle warning signs all along that you've been completely brushing off as normal digestion issues? Cancer is currently the #2 leading cause of death in the world, and in some countries it has already become the #1 cause. Some people argue that this is simply because we now have better diagnostic tools to detect it. While part of that is true, the grander incidence of cancer we are seeing today is genuinely growing at a rate that is getting out of our hands. Today we are going to talk specifically about gastric cancer, which is cancer found in the stomach. Many people confuse the stomach with the general abdomen. They will point to their lower belly and say they have stomach pain, when in reality the stomach is located much higher up, just beneath the rib cage. Let's remember exactly what the stomach is and what its functions are so you can understand how symptoms manifest. The stomach is the first major organ of digestion inside the abdomen. It has 3 main parts: the fundus, which is the top portion of the body, which is the main central area, and the antrum, which is the lower section. It has a closing valve called the pylorus that controls the emptying of food into the intestine, and another valve called the inferior esophageal sphincter at the top. After you swallow your food, the stomach is where the real heavy lifting of digestion begins. It produces powerful acid and enzymes that break down proteins, essentially acting like a second chewing process. The stomach muscles contract over and over again, mixing everything you just ate into a liquid state, so it can safely pass into the small intestine for nutrient absorption. Understanding this anatomy is critical, because the location of a tumor in these specific parts of the stomach will dictate the exact symptoms you might feel. Welcome to Human Health Zone, where we explore the hidden truths of health and wellness. If you want to take control of your body and catch warning signs early, make sure to like this video and subscribe to the channel right now. As we dive into these warning signs, keep one specific question in mind. What is the single most overlooked symptom that could indicate a tumor is already taking up physical space inside your stomach? I will reveal the answer near the very end of this video. I also want to mention that Human Health Zone is a fan channel created purely and only to give credit to Dr. Berg, DC, bringing you his incredible insights and research to help you live a healthier life. When most people think of stomach cancer, they assume it comes with a lot of severe pain, making it easy to diagnose. That is a dangerous assumption. Did you know that up to 70% of people who have gastritis, esophagitis, or some form of acid reflux experience absolutely zero symptoms? It is completely possible to have severe gastrointestinal damage without feeling a thing. Patients frequently discover they have gastritis by accident during a routine endoscopy and are completely shocked because they never felt any pain. However, there are other subtle symptoms related to poor gastric function that people completely ignore. Symptoms such as burping excessively after meals, feeling bloated all the time, or experiencing constant gas throughout the day. People often dismiss this as a colon issue, but in reality, it is often a digestion problem that started in the stomach. What has chronic gastritis and acid reflux to do with all of this, and how does it turn into cancer, you might wonder? Gastric cancer occurs when chronic inflammation over many years causes the cells in the stomach lining to begin mutating and converting into a tumor. I have seen patients who went in for a routine endoscopy completely unaware of any issues, only to receive the devastating news of a tumor in their stomach. So, what is the first warning sign you need to be aware of? If you have chronic gastrointestinal issues that just will not go away, please understand that this is not normal. Society has made us think that daily bloating and indigestion are just a normal part of aging or eating, but the fact that it has become habitual does not mean it is healthy. If you have persistent digestive distress, you need to go to your physician and ask for an endoscopy, because something might be growing without being noticed. But here is what nobody tells you about chronic heartburn. It can actually change the cellular structure of your organs. The second warning sign is a problem with swallowing. It could be painful, or it could just feel physically difficult to swallow. Cancers that occur right where the esophagus meets the stomach are incredibly common, and they are often directly caused by chronic untreated acid reflux. When the lower esophageal sphincter fails to close properly, stomach acid flows backward into the esophagus. The cells lining the esophagus are completely different from the cells lining the stomach, and they are not designed to handle acid. When chronic reflux persists, these esophageal cells begin to change and adapt to look more like stomach cells. This cellular change is called metaplasia, and the condition is known as Barrett's esophagus. Barrett's esophagus is a precancerous state that can eventually develop into a full-blown tumor, and the primary symptom is difficulty or pain when swallowing. The third warning sign is unexplained weight loss coupled with chronic nausea or vomiting. You might think losing weight without trying is a blessing, but in the medical world, it is often a massive red flag. If you are not on a diet and you are not exercising more than usual, but you're still losing weight rapidly, something is wrong. If you feel nauseated all the time and you are a woman who is certain she is not pregnant, or if you are a man experiencing sudden chronic vomiting, you need to get checked immediately. Before we continue to the next warning signs, remember that this video is for educational and informational purposes only and is not a substitute for professional medical advice. Always consult a licensed doctor for diagnosis and treatment. The fourth warning sign involves the presence of blood, and this is a critical indicator that requires immediate medical attention. There are two main ways blood might present itself if you have a stomach tumor. The first is vomiting blood. This can happen if the cancerous tumor becomes ulcerated, and that ulcer starts bleeding into the stomach cavity. However, not everyone with gastric cancer will vomit blood. Sometimes the bleeding is slower and hidden. This brings us to the second way blood appears, which is through a change in your stools. If you have a stomach tumor that is slowly bleeding, the blood will travel down through your digestive tract. By the time it exits your body, the blood will be completely digested, and your stools will look jet black and tarry. If you see fresh red blood in your stool, that usually indicates bleeding in the lower digestive tract like the colon. But if your stools are consistently black and dark, it means the blood originated high up in the stomach and has been digested along the way. Have you ever eaten just a few bites of food and suddenly felt like you had just finished a massive holiday feast? This brings us to the fifth warning sign, and it is directly related to the suspense question I asked at the beginning of the video. The single most overlooked symptom that indicates a tumor is taking up physical space inside your stomach is early satiety. Early satiety is the feeling of being completely full after eating only a very small amount of food. Why does this happen? When a tumor grows inside the stomach, it occupies physical space. It acts like a foreign mass that fills the stomach cavity, leaving less room for food. So when you eat just a small portion, the stomach sends signals to your brain that it is full, because the tumor is already taking up half the space. If you ever experience this feeling of extreme fullness after just a few bites, and it persists for more than a few days, you need to go to your physician immediately, because the tumor might already be quite large. The sixth and final warning sign is actually not a stomach symptom at all. Most people do not realize that the early symptoms of stomach cancer are rarely felt in the stomach itself. Instead, the first symptoms a patient experiences often come from the metastasis or the spreading of the cancer to other organs. A patient might suddenly develop liver dysfunction because the cancer is spread to the liver, or they might experience chronic coughing and breathing issues because the cancer has metastasized to the lungs. In some cases, the first sign is a neurological issue because it is spread to the brain. The cancer is already so advanced in the stomach that it has broken to the organ and begun seeding itself elsewhere in the body. This is why catching it early is so incredibly important. When gastric cancer is treated properly in its early stages before it is spread, it is completely curable. It is one of the greatest wins we as physicians can achieve against cancer. We must take these signs very seriously. Please do not normalize chronic digestive issues, and go ask your physician for an early diagnosis. If anything feels wrong, always prioritize having good digestion, and never ignore the signals your body sends you. If you found this video helpful, please like the video, subscribe to the channel, and turn on notifications so you never miss an update. If you personally relate to the frustration of chronic stomach issues or have a loved one who does, please leave a comment below and share this video with them. Finally, let us know in the comments which city or country you are watching from so we can see where our community is growing.